Dear Sylvia, like you, I was diagnosed a year ago with osteoporosis. I spent the first few months in fear of breaking a bone that would limit the things that I wanted to do. I stayed at home and avoided doing things that put me at risk for hurting myself. This led me to be very isolated and lonely. One day, I went to the grocery store and met a nice man that I started talking to a lot on the phone. I expressed my fears on doing things that could cause me to break a bone and possibly lose my independence forever. He asked me if I had ever heard of some medications called bisphosphonates. I told him that I hadn't. He said that they were more widely known by names like Fosamax, Digernel, Boniva, and Actonel. Those did sound familiar. He suggested that I speak to my doctor because those medications help people with osteoporosis and other diseases like Paget's disease. So I did. My doctor explained to me that it works by stopping my body from breaking down and taking minerals like calcium from my bones. This allows my body to build more bone instead of taking it away. Now, I know what you're thinking, Sylvia. I know you don't want to take a pill every day, but the good news is that most of the medications can be taken at 5 milligrams a day, 35 milligrams per week, or 150 milligrams just once per month. That gives a lot of room to better suit your lifestyle. I'm so glad that Marvin told me about bisphosphonates. I'm doing everything now that I wanted to do. I'm living a more fulfilled life with stronger bones.
Side effects can occur with any type of treatment, but not everyone has them or experiences them in the same way. Side effects of bisphosphonates will depend mainly upon the specific drug, the dose, length of therapy, route of drug, and the person's overall health. Side effects can happen anytime, during, immediately after, or a few days or weeks after bisphosphonate treatment. Most side effects go away when treatment is over. However, some side effects may last a long time or be more permanent. Common mild but potential serious side effects include nausea and vomiting, heartburn, abdominal cramps or pain, diarrhea, and constipation. These side effects are often mild and can be controlled with other medicines. The bisphosphonate may be given in 2 doses, once in the morning and again in the evening. It may also help to avoid lying down for 1 to 2 hours after taking the medication. Bisphosphonate should not be taken with food. Other rare but potential serious side effects include hypocalcemia, change in kidney function, skin rash or flu-like symptoms such as fever, chills, headache, and joint aches and pains, which are more likely to occur 24 to 48 hours after IV bisphosphonates are given. Tylenol may be prescribed to help relieve flu-like symptoms. Vitamin D and adequate calcium can be used as supplements, and you want to report skin rash if it is accompanied by confusion or shortness of breath. Adverse effects include osteonecrosis of the jaw, esophageal cancer, bone fractures, angioedema, Stevens-Johnson syndrome, toxic epidural necrolysis, and atrial fibrillation. It is important to report side effects to your healthcare provider. Sometimes, doses of bisphosphonates need to be adjusted or temporarily or permanently discontinued if side effects are severe and persistent. If you have hypersensitivity to bisphosphonates, delayed esophageal emptying, or the inability to sit or stand for 30 minutes, or hypocalcemia, then this drug may not be for you. You should speak with your healthcare provider to seek other options. This drug should be taken with precaution, and women who are breastfeeding, people who have esophageal disease, increased esophageal cancer risk, ulcers, gastritis, or poor dental health.